Hi, I'm Dr. Aparna Govil Bhasker. I'm a bariatric and laparoscopic surgeon who's practicing in the city of Mumbai in India. And the purpose for this video today is to discuss weight regain after bariatric surgery. This is a very common question that I face in my OPD consults, and most people who come in for bariatric surgery are actually very worried about weight regain in future. So number one, I think first and foremost what we need to understand is that obesity is a chronic progressive disease. This is something which we need to battle with lifelong. Bariatric surgery is a one-time intervention, but yes, a lot of work is needed after bariatric surgery so that the patients can maintain their weight. And this particularly includes following a very healthy diet. So of course your body is going to cooperate much more with you after surgery, and there will be restriction on the amount of food that you can eat. But then you need to seriously watch the diet that you're eating after bariatric surgery, because if you keep binging on sweets or keep having empty calories, keep taking cold drinks and things like that, which can go in easily. In medical terms, we call it the soft calorie syndrome, wherein you could add on a lot more calories by eating these soft foods. So say for example an ice cream, which would go in very easily and would give you a lot of calories that you don't really need. So these are the kind of foods that really need to be avoided after bariatric surgery. In addition to this, it is also very important to maintain a healthy exercise routine, because physical activity is an absolute must for weight maintenance after bariatric surgery. So most patients actually lose a lot of weight, and they would come to their nadir weight or the lowest possible weight in about say 1.5 years or so, which is about 18 months, and they tend to maintain their weight for the first 2 to 2.5 years. But post that, we do see that patients start gaining weight. The graph tends to go a little bit upwards, but it is not a cause for concern until say if you are putting on about 3 to 4 or 5 kilos from the lowest weight achieved. I think it's all right. But if the trend is upwards and you're not able to bring down your weight, I think it's extremely important that you touch base with your bariatric team, because when it's a question of losing the 3 or 4 kilos or say 5 kilos, it is not a very difficult exercise. This much weight gain can be brought into control by basic measures like diet modification or augmenting the exercise that you are doing. So these things can be done, and the other thing that can be done is to add a few medications which can again help to bring the weight down. Now I also see a lot of patients who actually have gained a lot more weight than that can be addressed just by diet and lifestyle modification. So if somebody has regained about say 30 kilos or 40 kilos of weight after bariatric surgery, I think they really need to see a bariatric surgeon and get evaluated in detail as to what kind of surgery did they undergo, and what has been the trend after that, what are the technicalities which are involved, and if required your surgeon would probably suggest you another option for weight loss in terms of a revision surgery or something similar. So yes, definitely weight regain is a reality, but the good news is that it can be prevented with very basic measures in your diet and lifestyle, and solutions are available. So I don't think we need to fret about it. But yes, while going in for bariatric surgery, please do not think that it is a one-time event or it's a shortcut for weight loss, because it is just 50% of the part done, and the story actually begins after you have bariatric surgery done. So take care everyone. Thank you very much.